Hey everyone, this is Dr. Autumn Henson with UNCG School of Nursing. I am a geriatric nurse practitioner and wound care certified and a professor with the graduate school here at UNCG. Today I'm very excited to present you guys with the very first annual pressure injury prevention education self-learning fair that everyone can participate in. Let's get started. So this is all in honor of the International Worldwide Pressure Injury Prevention Day on November 18th, 2021. So what's the big deal about pressure injuries? Well, one is always going to be your patient. We can never forget about our patient and thinking about them when they develop a pressure injury, the issue is pain, debility, deformity, and of course the worst case scenario is death. Then you're also looking at your facility, whether you're in a hospital healthcare system or you're in a long-term care facility, or if you're taking care of patients at home, you have to think about the cost, the legal issues, the fines, and the loss of business that you can encounter with pressure injuries. And then also globally, we have to think about the healthcare system, the financial, and the time. So what is a pressure injury? Well, this is a very long definition that came from certain articles, but mainly you can find it on the website of National Pressure Injury Advisory Panel. A pressure injury is where there is damage to the skin caused from pressure that develops a wound underneath. Now that pressure may be from the patient sitting or lying on a mattress or sitting in a chair for a long period of time, that pressure of the body pressing down, or it could be from a device that presses on the skin and opens up, causes those skin cells to die and can cause damage. So these are the pressure injury stages. So again, the big deal. Well, of course, pressure injuries don't all start out as a giant wound, but they do have different stages that they flow into. Now, sometimes you may not see it until it becomes a big open wound, but here's the different stages of a pressure injury. So stage 1 is a non-blanchable red area, discolored or dark area that's still intact skin, but it's non-blanching. So it means if you press on that area and it doesn't turn pale and then come back to the same color, that is non-blanching. A stage 2 is where it's an open dermis area. So there's no depth to it, but it is an open light pink, maybe a darker pink area. That is an open wound and it's partial thickness loss of the skin. The stage 3 is full thickness loss. So you're missing out on the subcutaneous and the fat adipose tissue, and it's open to that granulation tissue. Now, a stage 3 may actually have dead tissue on it. So that would be a slough or necrotic tissue or even eschar. Those have a little bit of depth to it, but you may not see the depth as much because think about it. Some of our patients have very thin skin, very small body size. And so a stage 3 may not show a lot of depth because they don't have a lot of subcutaneous tissue. A stage 4 is a full thickness loss of skin and tissue that you can usually see the fascia, muscle, tendon, or bone, cartilage, anything in that area. Now you may still see slough, necrotic tissue, or eschar, that dead tissue, and the depth can actually vary based on the anatomical location of the wound. So stage 4, that's the worst case one. That's the big, deep ones. Next are your unstageable wounds. Now those are the ones you can't see how deep they are. You know that they're full thickness because they're covered with slough, necrotic tissue, or eschar, but you can't tell me how deep it is. So that would be considered an unstageable. Deep tissue pressure injuries are near and dear to my heart. Why? Is because those don't raise their ugly head to be seen for about 3 to 5 to even up to a week later after the damage has been done. And so it's defined intact area that the damage has been done, typically in the subcutaneous to muscle tissues, and then they start raising up and shows this, maroon purplish discoloration that's non-blanching, very, very tender, and it could also be a blood-filled blister. A mucosal membrane pressure injury is actually one pressure injury you cannot stage. Those are actually caused in tissues that are more of the mucosal areas, so the nares. You could say maybe inside the ear, even further in there if there's some kind of a tube or something there, but also rectal tubes, Foley catheters in urethra areas. So those mucosal areas, that damage is done pretty quick. So if you think about just the nares and you think about inside the nair with the cartilage, If you have an oxygen tubing that's in that area and it causes a wound, that's different tissue than what I have right here. So you cannot stage those because they went deep pretty quick. Then you have your medical device related pressure injury. Now, those are the ones that we cause in the healthcare system. So those are the ones that we have either a cast or a brace, Foley catheter tubing, a bedpan, anything that presses itself against the patient's skin that causes that wound. So those are the medical devices, and usually they can conform to the pattern, the shape of that device. And so sometimes they kind of tell on you. So these are some pictures of the different pressure injury stages. I'm not trying to gross you out, just want you to be able to see the difference of a stage 1, a stage 2, a stage 3, and a stage 4. And then there's an unstageable, deep tissue pressure injury, a mucosal membrane pressure injury. You can kind of see it right there on the lip. And the medical device related pressure injury, where you can see that tubing and how that little, the little area there was caused with the skin. Now, what can you do? This is the big gun. This is what I want you to be able to pick up from the self-learning fair is what can you do? And it doesn't matter what part you play as far as in the healthcare system. You might be an EMT, a CNA, medical assistant, nurse, MD, CRNA, family member, physician's assistant, or a nurse practitioner. All of us can play a part, even to the family members that can play a part. The biggest thing I like to talk about is to keep them moving, all right? No matter what your patients are doing, the best thing is movement. That's the best way to prevent pressure injuries. Now, there's so many other things that you can talk about with nutrition and health and, all their chronic conditions. Yes, don't worry, that's a big prevention too. But what can you do is to help your patients keep moving. So encourage them to move often, and if they're immobile, reposition them. Get them moving around. Even if it's just during commercial breaks. If you have someone watch a TV and just say, hey, can you just move around during a commercial break? Repositioning is going to be a big deal. So keep them moving. Just like the childhood song, head, shoulders, knees and toes, knees and toes. Well, I developed this with head, shoulders, butts, and heels. This is where you would encourage your patients whenever you're walking around, whether it's in the hospital system, whether it's in a facility, or you're visiting your patient in the home. You can say, move your head around. Let's move your shoulders up and down. Let's see if we can reposition your bottom a little bit. Maybe moving forward, maybe leaning back, leaning side to side, either one. And then let's move your feet. So press those pedals on the feet like you're pressing the pedals on a car. So just get things moving around will make a big difference. So I welcome everyone to come join us for the Self-Learning Fair on November 15th, Monday, to November 18th on Thursday afternoon. There's going to be 2 different locations, either in the Nursing Instructional Building in room 334, and then also at the Union Square front lobby. There will be 3 stations set up in both of these locations, so you'll be able to learn a little bit more about pressure injuries and pressure injury prevention of kind of thinking about more of what can you do. So join us and definitely pick up some points about pressure injury prevention. Now, please go and prevent some pressure injuries. See you soon.